This clinic right here has 60,000 people on the waiting list for it. And today, I want to find out why.
In 2023, 10 people who stepped into this scanner were diagnosed with malignant melanoma. This isn't just tech for show. This technology could be life-saving, but could it also be the future of healthcare? Or is it just another innovation that might create more problems than it solves? I'm Jack, I'm a doctor in the UK, and let's dive into this and find out.
In a sci-fi scanning clinic, Neko Health maps the body with millions of data points.
If you founded the biggest music streaming service in the world, what would you do with your success? That was the question that Daniel Ek faced in 2018. Having built Spotify into the global leader in music streaming, outpacing even Apple, he was ready for a new challenge. He turned his attention to healthcare, where he saw a glaring issue, an overwhelming focus on treating disease with far too little emphasis on preventing it. In response, Ek co-founded Neko Health with Hjalmar Nilsson, an industrial engineer with a knack for innovation. Together, they set out to reimagine preventative healthcare. Neko Health focuses on three key pillars of health.
We want to look at areas where you can make small changes to your lifestyle now and make a big change to your long-term health trajectory. So those areas are going to be your heart and circulation, your body, and that includes things like your grip strength and your diabetes risk and your skin.
What truly sets them apart is their focus on prevention, combined with cutting-edge scanning technology developed in-house. They've also managed to make advanced health screening far more accessible, with a price point of £299. The Neko scan consists of two main phases, the testing phase and the review phase. My review and consultation was with a doctor called Sam, who was absolutely brilliant. So I'm going to be jumping between my consultation with Sam and the scan itself to help explain all this technology. Naturally, the first question I had was, what makes these scans so innovative? The body scan is easily the most striking part of the experience. In about 10 seconds, a combination of cameras and thermal imaging captures 2,000 images of your body, mapping every single mole and skin marking.
So if you just want to head on in for me.
Okay.
Initiating scanning. 3, 2, 1.
In dermatology, one of the key factors that we monitor is how a skin lesion evolves over time. If a lesion becomes asymmetrical, changes colour, or grows in size, it raises red flags. That's where the Neko Scan's AI comes in. It identifies and catalogues every lesion on your body. For me, that turned out to be 539 different skin markings.
So when you're in the skin scanner, we took 2,000 high-resolution photos of you, and that's across visible light and thermal as well. You can see the level of detail that we're capturing is going right down to the individual hairs and pores, and these are the skin markings that we've detected.
Yeah.
Now we take all of those and we put them into your personal skin catalogue. So don't worry, these four are here for interest, and that's the one that we took an image of.
How much asked?
So you've got 9 pages of markings, you can see here.
Yeah.
The real value of this comes with follow-up scans. By returning in a few years, the system can track changes in each lesion, helping to flag anything that may require attention.
And the really cool bit here is that as people have their scans, they get each year's image for this marking appearing down here. So we can look back and judge whether or not there's been any changes in the appearance of that skin marking.
Yeah.
If the AI identifies a lesion as concerning, it's automatically flagged for review by a dermatologist. This approach already has tangible results. According to Neko's 2023 data, they scanned 2,707 people and identified 10 cases of malignant melanoma, a cancer where early detection can be life-saving. Once the skin is mapped, Neko shifts its focus inwards to the heart and circulatory system.
We look at your blood pressure and we look at it at 4 places around your body, your arms and your legs. And that's because we're interested in the health of all of the blood vessels throughout the body. We took a recording while you're in there, which I think you guessed while you were on the couch.
Okay. Interesting, yeah.
So that's your heartbeat. It's something we record. So every Neko scan, we'll take a recording of your heart sounds, and then over time, if new sounds creep in, we're able to look back and sort of see the natural history of that.
Initiating tissue analysis. Right now, light at many different wavelengths is hitting your skin, which is either absorbed or scattered, enabling us to analyze molecular composition and tissue structure.
I couldn't resist nerding out to figure out how this works. Notice the green light. That's not just for show. It penetrates the skin and is absorbed by your red blood cells. Hemoglobin, the oxygen-carrying protein in your blood, absorbs green light differently depending on whether it's oxygenated or deoxygenated. This creates a contrast between blood-filled vessels and the surrounding tissues. This allows Neko to measure how effectively oxygen is being delivered to your deep and shallow tissues. This insight is really interesting because many chronic conditions can quietly affect the peripheral circulation, and a scan like this could help catch these issues early, long before symptoms appear. They measure high sensitivity CRP to assess your levels of inflammation.
Having even sort of relatively slightly raised levels of inflammation over years and years can damage your blood vessels and increase your risk of a heart attack or stroke. So we use this blood test, a highly sensitive CRP test. I suspect from your A&E work, you're pretty familiar with CRP.
Yeah.
But you're used to CRPs that are up in the 50s, 60s and more, I guess.
300 last week.
Oh my goodness.
Yeah.
Okay, right. Well, we're looking at the other end of the spectrum. So we're looking for levels actually that are much lower than a traditional CRP test can detect. Okay. And the reason that's interesting is if you've got a CRP level that's above 2 and definitely above 3, and it's like that over the long term, that can potentially increase your cardiovascular risk.
While we use CRP very widely in hospitals to detect infection and inflammation, its potential role in longevity is rarely emphasized or discussed. What's fascinating is how the same test, typically used for short-term diagnostics, is being repurposed in preventative healthcare to identify chronic inflammation and to encourage proactive interventions for long-term health.
So the next thing I'm going to measure is your grip strength, and the reason why we do this is studies have shown the better grip strength you have, the better recovery from diseases.
Yeah.
So if you don't mind planting your feet on the floor.
Oh yeah.
Perfect. And then with your arm at a 90-degree angle, I want you to squeeze as hard as you can on this, all right?
To evaluate your body, they focus on a few key areas: diabetes risk, eye pressure, and grip strength.
And squeeze, 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 squeeze as much as you can. Squeeze, 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 squeeze. And let go for me.
Now, I'm curious about your grip strength, and that's sort of making me want to ask a question, which is, are you left-handed?
No, my hands are
goodness.
significantly different sizes.
They really are, aren't they?
And I think, yeah, so I'm much stronger in the gym, everything on my left side.
Okay.
Just gonna show the camera. so I think that's why
There we go.
You can see with my palm size that it's significantly bigger on the
really
on
interesting.
the left.
Has that always been the case? Even when you were a
Always,
kid?
since I was little, yeah.
Wow.
Always.
Okay.
So
Grip strength is measured as a proxy for upper body strength because maintaining muscle mass as we age is strongly associated with better health outcomes and with longevity. When it comes to metabolic health, it's a growing societal challenge. With the rise of ultra-processed food, diabetes rates have skyrocketed. They assess your long-term blood glucose levels through a HbA1c test, which reveals whether you're either at risk of developing diabetes or whether you have it. What I found most interesting about Neko is they've carefully selected very specific tests that are highly responsive to small, actionable changes in your habits. Changes that can significantly boost your longevity, like wearing sun cream to stop your skin lesions from growing, or like improving your diet to help your HbA1c come back into normal range, or helping reduce your salt intake to improve your blood pressure. Just so many ways that you can make these small changes to your habits that actually impact your physiology. Could this be the future of healthcare? That question depends on many factors. What's clear is that healthcare needs to shift more towards a primary care and prevention pathway rather than reacting to diseases once they arise. This is where Neko seems to shine. Take a typical GP blood test. If the results are all normal, you'll never hear back from them. That's not a failing of the system, it's a symptom of how overstretched primary care is. GPs don't have time to sit down with every patient explaining how lifestyle habits can impact their results. Neko takes a very different approach. Here, the focus isn't just on the tests, it's on helping the patient to understand what those numbers actually mean. They walk you through each result with clear visual explanations that make complex data easy to grasp.
Working in a traditional medical setting, I don't have lots of visual aids to kind of help me explain what's going on.
Yeah.
But having these at your fingertips really makes it
Nice.
a joy. You can just sort of concentrate on the information itself rather than,
For me, those visuals were the standout feature. By blending thoughtful design with healthcare, they've created a remarkably effective way to empower patients to better understand and better take charge of their health. However, this raises a really important point, and I initially saw Professor Azim Majid, a GP and expert in public health at Imperial College London, speak about this to The Guardian. He said, "While Neko provides some initial feedback on the test results, the responsibility for ongoing care will largely fall on the NHS. This could increase the workload for general practices and other parts of the NHS, particularly if patients have findings that ultimately do not require additional treatment." And there's another issue worth considering here. While Neko's £299 price tag is far more accessible than the £800 to £1,000 charged by other private clinics, it still raises the critical question: could these services deepen the health divide in society? This journey has left me with far more questions than answers. In the short term, will clinics like Neko help to detect diseases earlier, reducing the need for costly hospital interventions by catching these conditions in their earliest stages? Or could they overwhelm the NHS with unnecessary referrals for findings that ultimately require no treatment? In the long term, the question grows even bigger. Could clinics like this help to ease the burden of chronic diseases, such as diabetes, cardiovascular conditions, and skin cancer, by creating a better informed population that takes greater ownership of their health? These are critical questions, and the answers will only emerge over time, as we see how these clinics evolve and integrate into the healthcare system. But they're questions that we must ask, because the future of healthcare, whether it thrives or fractures, may hinge on how we respond today.